Hello, everybody. Thank you again for coming to another one of our professional nursing mentor series. Today we are talking with Kristin. So without further ado, I'll give the microphone over to Kristin and you can begin.
Perfect. Hey everyone, I'm Kristin Weston. I am a nurse faculty member at the University of Northern Colorado up in Greeley, Colorado. Um, I I kind of teach all over the board, but my background is labor and delivery and high risk OB and OR nursing. So those are the two fields I dabbled in, and I absolutely love it. So I got some topics that you guys wanted to cover for nursing and the wonderful field of nursing. Everybody should be a nurse. I love it. Absolutely best thing ever. But I'll go ahead. Am I able to share my screen?
You should be able to. If not, I can make you a host.
Okay. Oh, I love it. Okay. Can we see?
Perfect.
Yay. Okay. So nursing, it is nursing. So kind of over the education of nursing, you have sometimes it gets a little confusing because you have all of the different levels of education that's required. You have your associates prepared nurses, your bachelor's prepared nurses, your master's prepared nurses, DNP, EDD, and those different levels. So the ADN nurse is it's an associate's prepared. It gets you what you need to know faster. It's usually a 2-year program. You have your prerequisites and then you do 2 years of nursing, and you have your associates. Tribal colleges, technical colleges, community colleges usually are the ones that do that. Um, and that's not a bad place to start. I was an associate's degree nurse and I thought it was the best thing ever. I got that degree at Oglala Lakota College. So I loved it. Absolutely wonderful. And then the BSN prepared nurse is just one more level above. They really have a lot of leadership and professionalism classes just to kind of not, you still get those basic nursing classes, but then you just get to level up a touch to think like kind of more on an administration slash ethical slash kind of, I don't know, it's like well-rounded kind of just professionalism, one more step above. And you can get your BS or your BSN while you're working. So it's not a bad route either. That's what I did through Arizona State while I was working at NIHS. So loved it. So then you have your ADN, your BSN. Then after you have BSN is a master's degree. This can be in various fields. This you can either be a nurse practitioner, leadership, or you can do education or public health. There are a lot of different routes you can do with a master's program. It just depends on what you want to do. I got my master's in education because I loved teaching. So that was kind of my route for that. Yeah, that's what I'm saying about that. But you have to have a BSN to get your MSN. So however you guys want to do it, either way. Then you have your DNP, the Doctor of Nurse Practice. This also varies of what you want to do with it. You have your practitioners, you have your education, you have your leadership. It just kind of depends on what you want to do. And again, that just levels up from the MSN. Then you have a PhD or EDD, same doctorate education, just kind of more research based. Than the DNP. DNP, you might kind of do like a project that practices specifically in the nursing field. With a PhD or an EDD, you can kind of play around with it however you want to. I'm currently doing an EDD, so I'm taking what different professions have to say, and I'm kind of forming it into how can I make the nursing profession and education better, or how can I add to it. So that's kind of my plan. That's my education path. For all of these different degrees, you are still a licensed nurse. You can still practice nursing. You still take the same boards. You take the same thing. You are still a licensed practice nurse. So I can be a full-time faculty member. But I still have my nursing license. So I can still, like if I want to, if I don't teach in the summer, I can still go to a hospital and work in the summer. So that's the really fun part about nursing is that with all these different things, you can do different routes, but you're still a nurse. So you can still do your nursing skills here, there, everywhere. Just depends kind of where you want to go with it all. Some people get their ADN and they say, I just want to be a nurse for the rest of my life. And that's a-okay. I love that. My plan was always like, okay, if I ever want to step away from the bedside, I have a backup plan. Or if I ever, and then, which is really nice, is I can go the opposite. I really want to get back to the bedside so I can quit all of this and I can go back and be a nurse. So it's a lot of different areas that I absolutely, absolutely love. So no matter what path you choose, you can still be a nurse. I saw the question about the NCLEX and how to kind of prepare that for the NCLEX. So this is the NCLEX breakdown. It's not like your usual test where it's like memorizing, like, where's the appendix? Where is the liver? What's your blood pressure ranges? It's kind of, it just levels up those questions. The NCLEX, the point of the NCLEX is to make sure we are putting out safe nurses into the field. So you are not going to have to answer questions on a provider level. You are just wanting to answer questions that proves that you are safe enough to take care of people. So you have your physiological adaptation is 10% of the NCLEX, and that's just kind of like you stubbed your toe, you have a pain thing. What do I do with this? Hold on, baby. Hold on, go see auntie. And then you have reduction of risk. You just lose risk potential. And that's another 12%. You have your pharmacology. They might give you, okay, you can sit with me. Tiny human wants to join. And he was going to be a firefighter. So there's this firefighter close. So you have your pharmacological. They're going to say this person has these symptoms. Which drug would you choose for this? Your basic care and comfort. How are you feeling today? What could we offer you? Physiological integrity, kind of 12% breakdown, health promotion, maintenance, infection and safety control. That's another 12%. I forgot to add that one. But a lot of it is the coordination of care. So the coordination of care is we are giving you a scenario and you are going to say how you would take care of that scenario. How would you take the best care of that person? And they'll give you options that don't seem right, but one of them has to be the most right. With that, the study tips, oh my gosh, I misspelled that one. Whoops. So study tips for the NCLEX is prioritization. The biggest question you can ask yourself while you're studying and looking at those answers that don't all make sense is what's going to kill them first? You're prioritizing your nursing actions in airway, breathing, circulation, ABC, or even safety. Like, so you look at your answers and see, okay, if I choose this one, will that one kill them sooner than this one? Or will this one kill them sooner than this one? Well, this one, can they live a little bit longer if I choose this answer? So it's kind of a prioritization. Where are you going to put your priorities with the scenario? Another study tip is read only the question that is in front of you. Do not read into the question. Do not say, okay, well, if the question was, grandma was at home drinking water, like, okay, was it hot water? Was it cold water? Was it in a cup? Was it in a mug? Like, just read the question. Grandma was at home drinking water. That's all you need to focus on. Grandma was at home drinking water. Don't think of what she was drinking. Don't think of how she was drinking it. The question asks, what was drinking water? Just focus on that. And then don't freak out. You are still in the game no matter what. As long as you keep answering questions, doing practice questions, and it hasn't shut you off yet, you are still in the game. So don't panic mode, and it's totally okay. Also, don't think about the questions that you already answered or you're going to answer, because that just causes anxiety, and I hate that. That's what I had to train myself not to do, was to think of the other questions that might be happening or the ones that I already answered. Just focus on the question that is in front of you. Also a study tip, will your nursing action, whatever scenario it is, whatever question it is, will your nursing action help the person or will it hinder the person? I think one of the best situations or one of the best examples that I was told one time during an NCLEX prep class was somebody has a tracheostomy, the little tube in your throat, and they cough and it shoots across the room. What should you do? And I was like, and the options were stick your finger in there, ungloved finger in the trach, rinse it off and put it back, or go run out to the hallway for help. So with those three, which of those three was going to help? Well, if you stick your finger in their trach hole, they're probably going to suffocate. So that's not what you want. Uh, Calling for help delays care. So that's probably not going to help anyone. But if you rinse it off and stick it back in, they might get an infection, but they will live at that moment. An infection we can treat and it won't kill them immediately. So that's just kind of where your mindset needs to be. It's like prioritizing those actions and then kind of seeing which one's going to kill them first. Really, really fun. I loved studying for the NCLEX. I hated it at the time, but after it, I was like, oh, I actually really enjoyed that process. Another topic that people were wondering about is helpful jobs while you're in nursing school. A lot of my students are phlebotomists and nurses aides, and that kind of really helps with your skill set. Nursing is a little bit more about your critical thinking skills and how to take the best care of people and how to see a patient from all different angles. But for beginning nurses, your skill set is also important. So being nurses aides, phlebotomists, those are actually very helpful jobs. Some people were like receptionists at chiropractor's office. That's another way of being in the health field without being a practitioner. You can also be baristas and waitresses. A lot of my students are those, and it kind of helps them with their multitasking skills. So they can do all of that. It's really, really great. But either way, no matter what job you get, if you just need time away from nursing, totally fine. You don't have to be an aide. You don't have to be a phlebotomist, or if you just want to be a little bit more, you can too. But no matter what, have boundaries with your boss. Nursing school comes first because that is what's going to get you to the next level, to your degree, not the job that you currently have. I sometimes they will push the limits and push your buttons and say, hey, can you pick up one more shift? Can you do this? Can you do that? I just need 4 hours here. But if you have a test that you need to study for or papers that you need to write, be like, I have stuff to do. And it's okay to say that. There's enough jobs out there and enough understanding that you just have to have boundaries. Make sure you put yourself first and your school first, because that's the most important part. So boundaries, no matter what you do. As far as new grad residencies and salaries, new grad programs are awesome. They were just kind of starting when I graduated. But you think you don't get paid as much as nurses usually get paid hourly wages. And the more you work, the more you get a bump and increase in your hourly wage. With that, you're with the nursing new residency, you're required to do kind of like more work just to get you into the field of nursing, get your mindset right, like in kind of nurse mode versus nursing school mode. So you'll have extra projects that you would get paid for per your hourly wage. And usually those are kind of hopefully rounded on your days off. They have cohorts to kind of everybody that graduates at the same time, they have cohorts. But for the most part, I don't think a lot of nurses have their hourly wages. So with that, you have your night differentials. You have to take into consideration, you might get like $5 more if you work at night versus work your day. If you work the weekends versus you work only days or like only during the weekday, you have those differentials. Holiday differential to pack into it. You might get $10 per the holiday, $10 more. It just depends, or even overtime. So different hospitals call them different things, but they'll have an all-call system where there's a lot going on and they will offer time and a half plus like $250 if you come in and help for at least 4 hours. So it just depends what you guys have time for, what you look for, and what your hospital offers. And take into consideration when you're looking at those hourly wages, your bills, kind of look at your insurance, what kind of insurance do you have? What kind of car payment do you have? What kind of free money do you want, like play money to go out and have dinner or coffee or whatnot? Just kind of take those things in consideration when you're looking at jobs and looking at hourly wages and salaries and stuff. The ones that are salaried are the school nurse, the educators, and like admin. They have a set salary that they get paid no matter if they show up or not. No matter if they do extra work or not, they get paid this amount of money. Um, those are okay. Sometimes it just depends on what you want to do. Um, for a school nurse, you only work during the school year and only work during school hours. So that is nice. They don't pay as much as you were if you were on the floor just because um they are not, I guess, critical. And I don't want to say critical because every nurse is critical, every job is critical. They're not as high census. They're not as high census. They have their working hours and they have their off hours. And they have set schedule. You also have your educators who are only working during the school year or during hospital hours, set hours, Monday through Friday, 8 to 5 or 8 to 4. And same with admin. So it really just depends on where you land. IHS hospitals, though, they do have a salary. So I started out, I think, at like 46,000. Back in my day. Oh God, I'd say back in my day. That's gross. I started out at that and then I got bumped up every time. So it just depends where you work, where you end up. But definitely when you do those nursing hourly wages, make sure you're looking at, your opportunities for overtime, opportunities for PTO, paid time off, opportunities for extra money, or if you don't want to work, like how can you get time off, time away, and like how much would it cost you? So those are just things to look at when you have nursing. You can also clump your shifts if you wanted to. Like usually people work 3 shifts a week, but if you wanted to, you can clump your shifts. You were like, okay, I want to work Friday, Saturday, Sunday, or Friday, Thursday, Friday, Saturday, however they do the weekends. You get to work Friday, Saturday, Sunday, and then work Monday, Tuesday, and then give yourself some time off and then do Wednesday, or you can just work another 3 in a row and get 6 days. You work 6 nights in a row and you get like 12 nights off. So it just depends. Other things to work about is how they schedule, but other things to consider. Yeah, and that's it. That's everything.
No, it's definitely some great information. Thank you for sharing that with us.
Yeah, you're welcome.
I guess I have some questions for you. So with the education piece, um, is there anything that you would recommend to students about, going into a higher level degree for nursing?
Um, if you decide to go into a higher level degree, I would give yourself time to actually be a nurse, to see kind of where you want to go and be an expert in your field, because the nurse practitioner, the purpose for them was to be, they were experts in their field and they wanted to be on the provider level with the nursing knowledge. So give yourself some time to develop your nursing knowledge before you hit that next level. So I think I was a nurse for like 7 years before I decided I wanted to go into education. And even then, I was still working at the bedside, and I could still work at the bedside and still become an expert in my field if I wanted to, and then teach along the way. So it just depends. Just depends. But that's my one recommendation is become an expert in your field before you hit that next level.
It's a really solid advice. Um, yeah, since I'm talking with some of the other mentors, my background is in art. I was a graphic design student, so I have no background on any of this. So it's really cool to listen to everybody sharing their knowledge and how different everyone's background is. We had one mentor talking about travel nursing because that's what she does primarily.
Oh, yeah,
Um,
yeah,
just like all sorts of stuff. So I think it's really interesting to hear this. Like all these different avenues that nurses can take.
yeah.
Is there anything that you've noticed within the nursing field or within like your own nursing friends or people
Yeah.
that you know? Is there any like trends or anything specific that you've noticed within the field since COVID or because of COVID or anything that students should think about moving forward?
What I noticed is there's just a lot of nursing burnout and that's actually one of my doctorate research things is the burnout rate and how to mentally and emotionally prepare nursing students to be nurses because it's a very big emotional load to carry. So kind of finding while you're working toward your nursing, kind of finding those avenues of where you can escape nursing and where it doesn't over and the feelings that you have so it doesn't doesn't consume you and you can stay at the bedside. Because right now I think probably within as the stats were couple weeks ago whenever I wrote. The new grad nurses only last 2 to 3 years, ever since I think 2020. That's like 2019 was when that article was written. So 2 to 3 years, nurses only last 2 to 3 years before they bail and go do something else. So really finding that avenue, because burnout is such a big thing since COVID, really finding an avenue of like where you can find a release. Like if you go do a dance class or you go do art or you go traveling, visit your friends, just some you need something to recharge you on your days off, because nursing is a very mentally, emotionally, physically taxing job. So just finding that outlet somewhere.
Kind of going off on that, is there like any type of like groups or any type of like nursing support systems within the field that you know about, or would you recommend like students kind of making their own groups like that for community support within nursing?
Yeah, I think that's coming more and more of a topic. Like it doesn't really exist. Um, and it just depends on where you work. Some hospitals are like, hey, we are hosting a get together here. We are doing this here. They like hospitals that really take care of their employees. I work for a surgery center. They're like, we're having a spring fling to say thank you. We're having this to say, just to because it's Wednesday. So we're gonna bring by you guys lunch. We're having a social get together. So it just depends. Usually within nursing, everybody finds their own groups and they're rock solid and lean on and depend on each other, because you're with your work people about 75% of your life. So you really find solid work people and you kind of do things as a group. So you create your own groups. Sometimes if people just find other avenues though, if they are not feeling their work group, I think my one coworker, she goes to a dance class and she has her dance group, and that's her like outside of work people. Um, but usually, yeah, it's kind of trending more to supporting nursing and their mental health versus, and it's getting there. But for now, just kind of everybody creates their own little groups.
Wow, it's really cool.
Mhm.
I'm trying to think. Is there any like skills or anything that you think is really valuable for nurses to have that students should think about learning, whether that's like a technical skill or like an interpersonal skill or just anything they should think about?
Sure. I always think that the best skill to have is kind of looking at whenever you see a problem or whenever someone presents you, have like 5 different plans in your head. When like really listen, your listening skills are like the most important ones. Really listen to what your patient's saying and like, okay, have like plan A if you think it's like this diagnosis. And you can think of diagnoses in your head once you get going. You can say, okay, this is a diagnosis. I think plan A is going to work. And then if that's not the diagnosis, you can say a different diagnosis and have plan B, plan C, plan E. Just kind of get used to having different plans for like 50 different plans for 50 different scenarios. Like really critical thinking, like, okay, and kind of spider webbing your thoughts, like, okay, they if someone is, oh gosh, a heart patient, you're like, okay, they're not breathing. I need to think about their airway. How should I have them sitting in bed? Also, I need to think about their output. I should check their pedal pulses because that's the furthest away from their heart. I should also check their lung sounds, because if their heart isn't producing as much output, I need to think about their lungs filling with fluid, or even the oxygenated blood getting backed up into the lungs. And so that could cause a fluid buildup. Just all these kind of spider webbing your thoughts on different topics. So that's a really, really good skill to have.
Cool. Yeah, that
And
makes
nursing,
sense.
yeah, nursing is like
Yeah,
a
this
spider
one makes sense.
web thought process versus linear.
Yeah, definitely. I
Mhm.
just remember the times that whenever I go to the doctor and the nurse is asking me all these questions, I'm like, man, you guys seem busy all the time.
Not even- Gosh.
Another question I have is, um, oh, I just had it. I just lost it. Hold on. It was a good one too.
Oh, that's the worst.
Oh, so I was speaking with a student a couple weeks ago and they were telling me how they were at one nursing program and they found a different nursing program that they thought was going to be like really cool. they're really going to like, but now that
Mhm.
they're in it, they really don't care for this nursing program as much, so they're looking into a new one. Is there any advice that you could give to students in that situation, or what they should think about when looking for programs to be a part of?
When looking for programs, find the one that's best fit for you. They might be the number one in the country, but they might be really, really hard heavy on you will get an A in this class. And if you get a B, you are less than the rest, and this is just not acceptable. So we can't help you. But if you find a program that best suits you, you'd be like, okay, I'm looking for kind of see what your needs are. I'm looking for support. I'm looking for faculty advice. I'm looking for small classes. I'm looking for culture and cultural awareness in programs and support for culturally diverse students. Kind of look for what you want in a school, not for what the stats say, not for what magazines say. Kind of look at what program best fits your needs. If it's a smaller school with smaller classrooms, and more individualized support, that is awesome. If you do want that high level, high ranking stuff, and you're okay with not having those different aspects, that's great too. Um, I know University of Colorado is really, really big on, or sorry, Northern Colorado is really big on cultural support and support for each student. I know each one of my students' names because the university is a smaller classroom. It supports a small class. So I know all of my students by their first name. I know what their boyfriend's names are. I know their dogs' names. I know um where they come from. So it's really just depends on what you are looking for. If you want the big school with the big names, awesome. But if you want that individualized support system, all of the where you feel like you're going to get the most out of from your money, go for that too.
Cool. Yeah, definitely. Makes sense. Um, trying to think. I did have another question. Oh, so just for like you and your experiences through your professional career, is there anything that you would deem as like your career highlight or, your favorite part or something really cool that you've done that you're super proud of? Can you share that?
Oh, gosh. I I don't know. I feel like all of it like it's just a process. Like you climb this hill, like you're in nursing school and you climb this hill and you get to the top and you're like, okay, I did it. Now what? And then you get a job and you're back at the bottom. And then you climb this like, okay, I really feel confident in my job. Now what's the next challenge? And then you just kind of do this like hill mountain process over and over and over. Yes, darling. To go to go. Okay, go see Papa and we will go. So it's just it just depends. Like you're going to have a lot of little triumphs and achievements throughout your nursing career that you can't really say one is the best one. There's just so many out, like so many little ones that you're ever so proud of. Like I can't name one.
No, that makes total sense.
Mm.
Um, yeah, it's been really interesting just to hear all the different mentors and their experiences and how I didn't realize how many different avenues a nurse can take. I
Yeah.
had heard of travel nursing before, but I didn't
Mhm.
know anything about the different like education levels for nursing and how you can still
Yeah.
practice while you're in school or like in the summer, like you said, go back to a hospital
Mhm.
to work. I just think
Yeah.
that's really interesting and really cool.
Yeah, that's always the biggest question is like, can I still be a nurse if I have this? I was like, yes, yes, you still can be a nurse. You never stop being a nurse. You just keep your license current.
That's so cool. Is there any last minute advice or anything you would want to give to students who are kind of either thinking about being a nurse or they're starting that process of getting into nursing school, stuff like that?
Yeah. If you're thinking about being a nurse, awesome. Do it. 1000% best career choice of my life. And if you're in the process of being a nurse, find the school that fits you the best. That's what's going to make or break your program is really make a list of what you're looking for in a school and kind of what you really, really want. And there is a school out there that will meet those needs. Call academic advisors, call the admissions office, call the school itself. They'll get you in touch with somebody and they will see like, yes, we can do that for you, or yes, we do offer that. We like, or some schools will be like, well, that's not really the way we run things here. And then you'll know. Then you're like, that's not the school for me, or that is the school for me. So really make a list of the priorities that you have, that you want for yourself as a student, and find the school that fits you the best.
Cool. Um, okay, my last question. Hey,
That's okay.
um, uh, do you have like a story or something that you can share with us, whether that's like a challenging story and how you overcame it, or whether it's a fun story that you just like to share during your time as a nurse, or anything like that?
Oh my gosh, yeah, I have a lot of them. There's a ton of them. But I think the one that I love the most was kind of it was a story about teamwork and how this lady, she came in complaint, she was pregnant, came in complaining of one thing, and me and the doctor and my other coworkers, we were all trying to figure it out together, and we were going to pull one more person in to do it, and just the team aspect, and like it wasn't what kind of was going on with her fetal monitor strip and everything. It wasn't looking like it wasn't bad, but it wasn't looking great. And we just couldn't figure it out. So all of us were like team working, the docs, the nurses, team working together. And then things took a turn for the worst, and everybody had my back. Like everybody just has your back. And all my coworkers, um, and the docs, they were all helping me get things together so we could get her C-section and get her kiddo out safe and make sure she's safe. But just like the teamwork aspect of it was just so incredible and impeccable. Like I can't recreate how it could have been if we were not a team. So nursing is a very big um, teamwork field. And even though you might have a patient, you could always go to your coworker and be like, I don't know what to do with this. Can you help me with this? Or even your doc's like, this is what's going on. I'm not sure what you want me to do or what I could do to make it better. And everybody, just the team of it all is so phenomenal.
Oh, that's so cool.
Yeah, it looked like
Um,
oh gosh, it looked like, remember on Mary Poppins with the penguins? They're just like running around everywhere crazy. That's what it was,
oh
like
yeah.
chaos. But at the end, everything, like we all had our place, we all had our part, and it was just great. Everything turned out fine. Mom did great, baby did great.
Oh, that's great. That
Yeah.
was a really nice story. Thanks for sharing that.
Yeah.
Cool. Okay, well, I think we are winding down now.
Great.
So thank you again, Kristin, for joining us. Yeah, thank you for sharing all that you shared with us today. Definitely a lot of good topics, like a wide range of topics. Great to hear from you.
Yeah, perfect. Thank you so much.